Hello and welcome to this special episode of our Health Nuggets, and today we have an opportunity to understand what glaucoma is. Basically, we are going to look at the health of the eye. Remember, this entire week, that is the world, we'll be marking Glaucoma Week. So basically just trying to inform the world or inform the public about what exactly is glaucoma. My name is Aida Munzati, and as I mentioned, today we are understanding what exactly glaucoma is. And in studio, I'm being joined by eye specialists from PCA Kikuyu Hospital, and together we are going to understand what exactly this eye condition is. And we begin to my far right. Please feel free to introduce yourself.
Good evening. My name is Esther Kamau, and ophthalmic nurse at PCA Kikuyu Hospital. Yes.
Thank you so much, Esther, and we look forward to learning from you.
Thank you.
Daktari.
My name is Dr. Faith Masila. I'm an ophthalmologist and glaucoma specialist at PCA Kikuyu Hospital.
All right, so feel free to send in your questions or comments, that is using our SMS number, or directly to our Facebook and YouTube channel where we are coming to you live. That's CAC TV Kenya on Facebook and YouTube. So Daktari, we begin with you by basically trying to understand what exactly glaucoma is.
So glaucoma is an eye illness that leads to damage of the nerve which enables us to see. And most of the time it is caused by high pressures. It's also a disease that happens very gradually, such that one may not notice when it is starting. But if unaddressed, eventually the effects of pressure on the nerve leads to damage of the nerve, and then reduced vision, and eventually blindness sets in.
All right, and Esther, as a nurse, you've interacted more with the community, you've interacted more with people on ground. Just help us understand what's the situation like on ground. As Dr. Masila puts it, it's a condition that probably gets someone gradually, or affects someone gradually. So how would you say the condition is on ground in terms of if there are statistics in Kenya, what's the prevalence?
In Kenya, we have a major problem because most of the patients do not know they have glaucoma. And that is why we need to have more, to create more for an eye checkup, so that glaucoma can be detected early and treatment started early enough to avoid loss of sight. Yes.
So on ground, have you interacted with more patients that have glaucoma?
Yes, many of them. Yes.
All right. So you will say the prevalence in Kenya is high. Okay.
Yes.
And what would you say are some of the checkups that you do in terms of identifying glaucoma?
At Kikuyu Hospital, we do the intraocular pressure check. We also check on the nerve to see if there is any damage that could have been caused by the high pressures. We also do some a test that detects the loss of vision, peripheral vision, because usually glaucoma affects the peripheral vision, such that someone you are not able to see from the sides.
Okay.
Yes. Yeah.
All right, and Daktari, before even we get the opportunity to have a look at the checkups, and of course that is the instrument that you use, what is this specialist looking for, or what are the signs and symptoms that glaucoma presents with?
So glaucoma is mostly, like, the symptoms are not dramatic. So it's really hard to even tell that one is experiencing symptoms of glaucoma. So some patients might feel some headache, but then again they can ignore it and just take painkillers. Others may feel the vision is a bit blurry or smoky or misty, but then again they can just ignore it or go and get spectacles. And some feel a little bit of eye pain, so they can think maybe they're just tired and they take painkillers. Now when they do this, they don't get the checkup and they don't get treatment for glaucoma. So eventually, you know, the nerve continues getting damaged because pressure is getting higher and higher, and then they lose their sight or their very little vision. At the sight of very little vision, that's when now the symptoms become more visible. They find they've lost a lot of their side vision. So they can bump into walls, they can fall down the stairs, they can fall into ditches, they can get accidents when driving. So, and they can just now find it difficult to see. By that time, the vision is almost gone. So in early stages, little symptoms, and if there are any, they're ignored and attributed to just normal eye and bodily discomforts. Only at the later stages is when the poor vision becomes more noticeable. Yes.
All right, and as you mentioned, of course, it's something that is happening gradually.
It's very gradual.
Okay.
Yes.
All right, and now to you, Esther. Just give us an experience of what exactly you do in terms of doing the eye checkup now with the instrument that you mentioned.
Okay, the instrument that we have here, it's called a tonometer. The tonometer checks the eye pressure, the pressure of your eye. We use this instrument. This is part of them. There are several, but this is part of one of them. This one, we have this thing here. This one taps your cornea. It taps the cornea. By tapping, you type like 5 times, and you get a reading from here. Yes, it's a digital one, but we have others. Yeah.
Okay, so the cornea, maybe is it something that you can do for me?
Even if you don't take an actual reading.
Okay. Maybe we can show you how we do it. You hear that sound?
Yeah.
Yeah.
Okay.
So that's what happens. It will give you a reading at the after 5 times, then you read the pressure. Yes.
So in terms of reading the pressure, of course we have the numbers there as you say.
Yes.
So as you look at that, which one is normal in terms of the numbers, and which one would you say now is abnormal, and this person now needs to be treated or maybe for further checkups?
The normal intraocular pressure ranges from 10 to 21. So if it goes above 21, that calls for more investigations. Yes. Though the intraocular pressure is not the only diagnosis, does not conclude that you have glaucoma. It has to be followed by other checkups. Yes.
And which are these other checkups?
You have to check the optic nerve, the condition of the optic nerve. And as I said, you have to check the visual field. Yes. Yeah, the patient loses the peripheral vision. And this person usually remains with tunnel vision. That this patient is seeing on his street. The patient may say they have normal vision, even if you take the visual acuity, the vision may be normal. But when you check the peripheral vision, it is gone. Yes.
All right. And Dr. Masila, who would you say, or what are some of the risk factors of glaucoma, or who is affected mainly by glaucoma?
So some of the people who are affected are people who they already have like a family history. So if it runs in the family or it's genetic, then they are at a higher chance. Then you have people who are much older, like 60s, 70s, although glaucoma is also now very much found in people younger in their 40s, 50s, even like late 30s. Also you have the race, so African race is more affected than most other races. Then you have other diseases of the eye, short-sightedness, you have diabetes in the eye. So, or just generally, if you're a person with high pressures, you're at a higher risk compared to somebody with low pressures or normal pressure. Although we have a few people with normal and low still getting glaucoma.
Yes. Does this mean that the issue of age for the young people, in terms of those that you've treated at the hospital, would you say maybe the young people are more affected, or the older group of people is more affected?
No, so basically prevalence of glaucoma increases with age.
Okay.
So it's much higher in older people, but that does not mean all older people will get glaucoma. But its chances or its frequency increases with age. But nevertheless, probably because screening is done now more often, it is being picked out also in younger people. So we have quite a huge percentage in younger people. Yes.
Right, and thank you for that. Now, Esther, you mentioned of checkups,
Yes.
and Dr. Masila has also mentioned of how glaucoma happens gradually. So, what would you say is the importance of now regular checkups, so that if it's catching glaucoma, you now catch it at an early stage?
It is important that we have our eyes checked regularly, because there is no time that glaucoma will cause your eyes to ache, so that, you know, if you, when you have something, a tool that aches, an eye that aches, definitely you'll go to the hospital. But in the case of glaucoma, there is no pain. The only thing that you may notice is you are starting to lose your distant vision. You cannot see far. Your vision is getting blurred, so you can't see clearly from a distance. And it may be too late when you start noticing these symptoms. So we encourage people to have their eyes checked. There are so many days that we encourage people to have their eyes checked. We have when you have the glaucoma week, we usually have the World Sight Day in October. So I think there are many opportunities that we keep reminding people to have their eyes checked. Yes, because that is the only way we can pick. And we also encourage, even outside these weeks or outside these campaigns, we need to present ourselves to the hospital, yes, to have our eyes checked. Yes.
Okay, that's great. Now, before we take a very short break, Dr. Masila, you've mentioned of some of the signs as well as some of the symptoms and the risk factors as well. Is there a chance of maybe an injury to the eye causing glaucoma? And for glaucoma, would you say there is any specific way that the eye looks like?
Yes, so what we were speaking about is the primary glaucoma.
Okay.
But you have secondary glaucoma, where there is like another condition that triggered the glaucoma. So it could be trauma, you were hit, or you got an ocular illness, an eye illness, and then it led to pressures. It led to glaucoma. So you could have, there are many. There are cancers of the eye, there's bleeding into the eye, there's trauma, all these kind of things. Inflammations in the eye, they can cause glaucoma. So now you just call them secondary glaucoma because they are caused by something else, and sometimes it can just happen in one eye. But the primary glaucoma is mainly a disease of the two eyes. But sometimes you can get a secondary cause happening and causing glaucoma in both eyes. But the primary one is usually a disease of both eyes.
All right. Thank you so much for clarifying that. And I will be taking a very short break. Of course, we will be coming with more on matters to do with glaucoma, of course, looking at treatment as well as prevention. Remember, we are bringing you this particular program on Health Nuggets, of course, understanding glaucoma, in the week of Glaucoma Week. That is a World Glaucoma Week, and the theme for this year is Uniting for Glaucoma-Free World. Of course, we have looked at the prevalence that's in Kenya and of course worldwide as well, and it is an issue of or a matter of public health concern, and therefore we need to create more awareness as much as we can, and that's exactly what we are doing right here on Health Nuggets with the help of our experts or specialists from PCEA Kikuyu Hospital. And of course, after the break, we'll just be telling you what exactly will be happening at PCEA Kikuyu Hospital this entire week in terms of preventing glaucoma and of course offering you solutions to do with glaucoma. So let's take that quick commercial break. We will be right back with much more.
My First Bible presents Joseph the Dreamer.
Muremi mureithia wa nguku kambuni yake Agro Suppliers Limited ne koromboetie gakurehera dawa etagwo Notix. Huhereria Notix kiaga-ini kia nguku iria ne njagirithie makiria kuraga tutambi tuothe twa nguku ta thuya na gutu, koguo gukuhe umithio reithia-ini waku. Oho Notix ni uragaga nekanina kaimana tutambi na turugi tuothe tuthinagia mahiu ta nguha, glaucoma na ngi. Notix ironeka thiini wa Agrovet hakuhi nawe. Uhoro makiri atwaririe kugerera namba ici: Notix, dawa namba 1 hari kunina tutambi twa nguku kana mahiu kuma Agro Suppliers Limited.
Did you know that more than 130,000 children fail to join secondary education due to lack of school fee? Did you know you can help a child get a bright future by donating 1 shilling and 50 cents per day? Join the NCCK Scholarship Program today and give hope to a needy child. The NCCK Scholarship Program pays school fees for bright and needy children in secondary school and also gives them psychosocial support. Text ELIMU to 29888 to brighten a child's future and give them hope. Send ELIMU as an SMS to 29888, then reply with 1 to subscribe to the 29888 ELIMU for 1 shilling and 50 cents per day. When you text ELIMU to 29888, 1 shilling and 50 cents will be deducted from your airtime daily for 3 months. The NCCK Scholarship Program is an initiative of the National Council of Churches of Kenya in partnership with Saidika, a digital fundraising platform. NCCK will publicly account for all funds received from the drive. Join NCCK in changing a child's life with only 1 shilling and 50 cents daily. Text ELIMU to 29888.
Kupoteza mpendo wako ni jambo zito, kwa hivyo unahitaji mwandani wa kutembea nawe. Kwa kiwango cha shilingi 10,000 tu, runinga ya CAK ya kuhakikishia matangazo ya tanzia yaliyoboreshwa. Ofa hii inasheheni video ya dakika 2 na sekunde 30 itakaonakili tangazo la kifo, mipango ya mazishi, halikadhalika ujumbe maalum wa kumomboleza mpendo wako. Yote haya ndani ya video moja. Video hii itaandaliwa kwa lugha ya Kiingereza na Kiswahili na kupeperushwa kupitia runinga ya CAK ili kukupa hakikisho la kuwafikia watu wengi. Muhimu zaidi ni kwamba familia mwenda zake itapokea video zote 2 kupitia mtandao wa WhatsApp ili kuwawezesha kuwasambazia jamaa na marafiki wa matabaka mbalimbali, wakiwemo wale walio uhaibuni. Ili kutenga nafasi ya tangazo au mawasiliano zaidi, zungumza nasi kupitia nambari za simu 0111220044 au 0110090647. Asante kwa kuichagua runinga ya CAK kuwa mwandani wako wa matangazo ya tanzia. Tupo hapa kutembea nawe katika safari ya kumkumbuka na kumwenzi mpendo wako aliyetangulia mbele za haki.
Muremi mũrĩmi mũrĩithia wa ngũkũ, kambuni yake Nagro Suppliers Limited nĩ ĩkũrũmbũĩtie gakũrehera ndawa ĩtagwo Notix. Huhĩrĩria Notix kĩaga-inĩ kĩa ngũkũ, ĩrĩa nĩ njagĩrithie makĩria kũraga tũtambi tuothe twa ngũkũ ta thuya na gutu, koguo gũkũhe umithio ũrĩithia-inĩ waku. Oho, Notix nĩ ũragaga na ĩkanina kaimana tũtambi na tũrũgi tuothe tũthĩnagia mahiũ ta ngũha, Glaucoma na ngi. Notix ĩroneka thĩinĩ wa Agrovet hakuhĩ nawe. Ũhoro makĩria twarĩrie kũgerera namba ici: Notix, ndawa namba 1 harĩ kũnina tũtambi twa ngũkũ kana mahiũ, kuma Nagro Suppliers Limited.
Did you know that more than 130,000 children fail to join secondary education due to lack of school fee? Did you know you can help a child get a bright future by donating 1 shilling and 50 cents per day? Join the NCCK Scholarship Program today and give hope to a needy child. The NCCK Scholarship Program pays school fees for bright and needy children in secondary school and also gives them psychosocial support. Text ELIMU to 29888 to brighten a child's future and give them hope. Send ELIMU as an SMS to 29888, then reply with 1 to subscribe to the 29888 ELIMU for 1 shilling and 50 cents per day. When you text ELIMU to 29888, 1 shilling and 50 cents will be deducted from your airtime daily for 3 months. The NCCK Scholarship Program is an initiative of the National Council of Churches of Kenya in partnership with Saidika, a digital fundraising platform. NCCK will publicly account for all funds received from the drive. Join NCCK in changing a child's life with only 1
Welcome back to Health Nuggets. Of course, it is a special episode of our Health Nuggets where we are looking or learning about glaucoma. So if you're just joining us, of course, we will have a very brief recap of what exactly we've been able to discuss in terms of understanding what glaucoma is. But just to let you know that the world is marking World Glaucoma Week. That is from Sunday 10th yesterday throughout the week. That is Saturday 16th of March, and the theme for this year is Uniting for Glaucoma Free World. Basically just trying to create awareness about glaucoma, but the most important thing is, as much as we are creating awareness, of course, to try and prevent the cases of glaucoma. So Esther, to you now, we just give us a recap, but most importantly the definition of what exactly is glaucoma and how does it manifest.
Glaucoma is basically caused by a rise in the pressure inside your eye. It also affects the optic nerve, the nerve that helps us to see. It's the nerve that sends images to the brain for you to be able to see. Yes, that is how it is damaged. Glaucoma slowly takes the vision away. It is called the silent thief of sight, because slowly, silently, it takes away the sight. Yes.
All right, and now to you, Dr. Masila, I'll just take you back to the basis of the eye. Of course, Esther was able to mention that it is the cornea that is affected. But of course, in is it primary or high school where we are taught the parts of the eye, so that the audience understands which part exactly is affected, maybe just the parts of the eye for the audience to understand this part that is affected.
So mostly, the part that is functionally affected, that is responsible for vision is the optic nerve.
Okay.
But of course, other structures in the eye can be affected when the pressure is high, like the cornea, which is the front part of the eye, the transparent, clear part.
Okay.
So under conditions of extremely high pressures, 40s, 50s, 60s, and even above, you can get cloudiness or, looking a bit gray, and it can tell you that the pressure is high. But that is very extreme and not so common in adults. But in children, it's common because there are children, babies who are born with glaucoma, or it develops when they are 1-2 years, and then the pressures are high, it's very noticeable. So they look, like they have grayish eyes, cloudy eyes. You can just pick that it's not clear. Yes.
All right, and of course, when you mentioned of the gray eye, would you say there's a specific way in terms of how the eye, like the entire eye, will look like for you to pick that this could probably be glaucoma?
Yeah, so we've talked about the cornea becoming cloudy, hazy, but we've also, in children, because their eye is still young and it can stretch as a result of very high pressures, the size can increase, and it can really increase to very huge sizes. So if it's one eye, then you can see it's disproportionate compared to the other. But even if it's both eyes, both eyeballs can become so enlarged and so cloudy that when you compare with a child of their age, you can notice there's a problem. This eye or these eyes are looking a bit extra large, and they are also, discolored. Yes.
All right, and I'll still stick to you. You've mentioned of course, we've looked at what glaucoma is. We have looked at the signs. You've mentioned that it happens gradually, as well as the risk factors. For someone at home who is maybe has picked this particular telltale signs, what are the treatment options like?
So even if they pick them at home, they have to come to hospital to be checked, and the proper management regimen is started for them. So if they're children, usually you give drops as you prepare to do surgery. But because the kind of glaucoma in children, it's unsustainable to put drops. Drops will not even completely lower the pressure. So they have to undergo surgery. For adults, depending on the type of glaucoma. So you have to characterize which type of glaucoma it is. Of course, most of them are the primary, and most of them are open angle. So if you're talking about that, you can get away with doing eye drops for the rest of your life with frequent checks. But depending on various conditions, eye drops may not be sustainable for life because some of them are very expensive. So eventually the patient may not afford, they'll stop putting, they'll go blind. Or they live very far where they cannot really access these drops. Or for them, just putting drops is an inconvenience, so they drop burden. So they'll just fall out. So for such cases, you just do surgery, which will lower the pressure to a normal level, and they can now maintain their sight without drops. Or if drops, maybe just one drop only. In severe cases, patients have to put 3 or even 4 drops. So there's surgery, there's eye drops, and there's laser treatment, depending on the kind of glaucoma. So there are glaucomas which, you need to do the laser. Some angle closures, you need to do the laser, and even some still primary open angle, like you find they're reacting to drops. Another reason why someone may not use drops, they could be reacting. So for such cases, you may just have to do laser, and if it really works, there's some good success rates, you can stop the drops. And so laser is another option for them, and some may not even want surgery. They may not be able to keep drops every day, but they may not also want surgery, so you might consider a laser. So the treatment is tailored from individual to individual, basically client-based. You can't really say all the glaucoma patients will undergo surgery, or all of them will use drops, or all of them will use laser. Yes.
Right, and for depending on how severe it is, what are the chances of regaining eyesight for this particular individual that has completely lost eyesight due to glaucoma?
So there is no issue of really much issue of regaining. It's more of protecting what is left. So depends on the stage the patient comes in. If they come at an early stage, then you stop the disease early when they have a lot of sight. If they come, when it's a bit advanced or moderate, you stop it at that stage. And if they've come when they've lost the sight, you still manage the pressure so that they are not in pain, but you may not regain the sight. So the sight at which the patient comes, at the stage at which you aim at preventing further progression. But, you cannot really reverse because it's the nerve that is destroyed and gone. So if a nerve and its function has already happened, you may not be able to restore, but you can prevent. Yes.
All right, of course, we will be looking at prevention later on. And now to you, Esther, once again, you've interacted more or been on ground more with communities, basically either treating or just doing eye checkups. Let's look at the issue of myths and misconceptions around glaucoma, especially when it comes to age. Of course, there are those people, maybe if someone is a 70-year-old or 80-year-old, they look at the issue of losing eyesight as just an age issue.
Yes, that's very true. For those people who are aged, they'll feel like I'm losing sight because of my age. So even convincing them to go for treatment, it's not that easy. The other thing is, glaucoma, as we've been told, may run in families. So you find that there are people, maybe a grandmother lost sight, the daughter lost sight, the grandchild lost sight. They may also think that they've been bewitched.
Yeah.
Yes. That's something else. There's a misconception also where they think that if you give them eye drops, it's going to treat their glaucoma. It will lower the intraocular pressures, and it will also prevent further damage, but it is not going to completely cure the glaucoma. So once you encounter a patient who has glaucoma, it is very important to do counseling on this patient. Because you need to tell them, if they are taking drugs, it has to be lifetime. If they come to us when the vision is too much gone, they are not going to gain their sight as it was before. Whatever is going to happen is preventing further damage. Yes.
And now, Dr. Masila, would you say, in terms of prevention, are there any lifestyle changes or maybe things that we do that maybe contribute to us maybe being affected by glaucoma?
Yeah, not like other diseases, but just some small things here and there, I guess, can help. Yeah, because, well, it's thought if you take excess fluids, things like excess caffeine, the pressure can go up. If you do certain types of intense physical maneuvers, exercise, which really require a lot of effort, then you can just cause some imbalance in the pressure of the eye, and then you get your pressure up, like yoga and things like that. So there are those intense physical maneuvers, intense intake of fluids, certain kinds of fluids, certain kinds of musical instruments, the wind blowing instruments. Because of the pressure, it's, like thought it can increase the pressure. But other than that, the normal lifestyle changes, I don't think it's really related to a particular food, like saying I should not eat this or I should not eat that. But when you are generally healthy, it's also healthy for the eye. Like, eating the right kind of foods, just exercise and all that,
Okay, and something else is that we are in a very digital world in terms of our phones, laptops, and the issue of even the sunlight. Is it a contributor, and how can we prevent?
Yeah, I think it's not quite the best, like to just be too much on the screen, because you strain your eyes. And sometimes I've seen patients who have been so much of an excessive screen time, they get inflammations. Now, inflammations, remember we said, was one of the cause of secondary glaucomas. So you can just trigger your eyes so much, get so much inflammations, and now these inflammations can come with high pressures. Yes, it may not be a direct contributor, but it does impact our eye health. And so excess use of like technology in disproportionate, kind of ways are not good for the eyes. Yes.
Okay, and Esther, something else, maybe in terms of still prevention, we have individuals that are, especially with the current generation, where we are seeing, can I say, eyeglasses as that fashionable thing. What is the importance of me as an individual not prescribing eyeglasses for myself and rather going to a specialist, so that we are protecting our eyes and of course the issues to do with pressure to the eye and glaucoma?
I would advise we should not go for glasses. If you have a problem with your eyes, just go see an eye doctor so that they'll diagnose what problem you have and give you the right treatment. If they find that you need glasses, they will definitely prescribe them for you. If it is something else that is affecting you, you'll be advised accordingly. Yes.
Right, that's great. I hope the audience at home, of course, are following. Let us now look at, of course, throughout this week, the activities that will be happening at PCA Kikuyu Hospital. Just shed light into what exactly will be happening. And if our audience, those that are watching from home, can be part of these activities.
Everyone is welcome to come for glaucoma screening. We are doing it free of charge. When you come, we'll check the pressure in your eye and we'll check the optic nerve if there are any changes that could have occurred from glaucoma. Yes, we are not charging. It is extremely free. Just walk to the eye clinic and you'll get the required assistance.
All right, and that's happening from when exactly to?
It is happening, we started today through Friday. Yes, from morning to evening. Yes.
All right, and of course, let us speak a little bit. Of course, we have looked at glaucoma, but PCA Kikuyu Hospital is one of the largest hospitals when it comes to their eye units. Dr. Masila, to you. What are some of these services that are offered there that our audience are able to come and get these services, other than, of course, the activities that are happening this week? So beyond this week, what are some of these services?
In the hospital or in the eye unit?
In the eye unit.
So we have ward facilities. These are facilities for keeping in patients who require more intense treatment. So they have to be admitted for a few days or admitted in preparation for surgery. And so that is available. We have clinic where diagnosis of various eye illnesses is done. And treatment is also offered at the clinic. There are equipment for diagnosing these eye diseases. There is a pharmacy. Then we have the eye theater. So surgeries are done. There's equipment for doing the surgeries. And so we have those services. We also have outreach, of which Esther is one of the in charges of the outreach, where they go to the community, they screen people with various eye illnesses, refer them to the hospital, and they are treated. There's also the optical workshop. People who require glasses, they are measured, they are found to need spectacles, and this is offered also in the hospital. And basically other activities like low vision services. So those who have very little vision or they've lost their vision, they need to be rehabilitated. So the low vision unit caters for these individuals. How do they go about living their lives even with reduced or loss of vision? So there are low vision services in addition.
All right, and Esther, I don't know if you can take this. I've visited PCA Kikuyu Hospital on several locations, and I have seen the huge queues that you have of people seeking eye services. How do you deal with these queues and this large number of people? What exactly does that tell us in terms of the eye problems that we have in the country?
I think this eye services are not many hospitals are offering eye services.
Okay.
That's one. And also Kikuyu Hospital, we are known for quality eye services, and that is why we get so many patients. We are able to handle the numbers because we have enough doctors who handle those patients. Yes.
All right, that's great. So we have come, of course, to the end of our discussion on understanding glaucoma, but I'd like us to give parting shots as far as glaucoma is concerned. We begin with you, Dr. Masila.
So my message would be get your eyes checked and basically don't ignore any symptoms. Yes.
Great. Esther?
Mine is to encourage people to have their eyes screened. As you've had glaucoma, you won't notice. You won't feel any pain. Your vision goes silently. So you're encouraged to come for a checkup. Even if it's not during this week, you can come, pay consultation and have your eyes checked if you don't get a chance this week. And also, if you happen to be diagnosed with glaucoma, encourage your other family members to come for checkup, which will also prevent them from losing their sight from glaucoma.
Okay, thank you so much for this. There's something very important, or such a catchy line that you share, that glaucoma is a silent
thief of sight.
Okay, great. So glaucoma is a silent thief of sight in terms of how gradually it happens.
Yes.
Right. Thank you so much, Esther, and thank you, Dr. Masila, for your time. Thank you so much for informing our audience as far as glaucoma and, of course, the eye health is concerned. Right, and to you, our dear viewer, thank you so much for tuning in. That was Dr. Faith Masila, an ophthalmologist as well as a glaucoma specialist from PCA Kikuyu Hospital, and Esther Kamau, a trained ophthalmic nurse from PCA Kikuyu Hospital. So this particular conversation was coming to you on this special episode of Health Nuggets, since the world is marking, that is, a World Glaucoma Week, trying as much as possible to create awareness about glaucoma. Of course, we've been able to understand what glaucoma is, the science, which according to the specialist, this happens gradually. We've also been able to look at the risk factors, treatment, and most importantly, prevention of glaucoma. So as the world marks Glaucoma Week, the PCA Kikuyu Hospital is offering free eye checkups throughout the week. So if you have an opportunity, feel free to visit them and take advantage of these particular services. So this particular week, or Glaucoma Week, the theme is United for Glaucoma Free World. So once again, asante sana for tuning in to Health Nuggets. My name is Aida Munzati, and as you always say, your health matters. See you on the next episode of Health Nuggets.